Yeah, I'm on TRT. Yeah, I'm on HRT. What has happened where, what can you tell us from the perspective of steroids today? What does the average person not know about? Have we found, I read a book about 12 years ago called Ageless Man, where they were testing TRT and steroids with, different things to say, if the testosterone level is higher, your heart is actually doing better. What have we learned about steroids?
It's a fascinating subject, and I think you and I grew up around the same time, and steroids were seen as this way to get buffed up. And people do feel better on steroids. Steroids are a natural chemical. When you take exogenous steroids, there are some short-term benefits, but there's long-term harms. And that's why the medical community warned against people buffing up on steroids just to look better and feel better in the immediate short term. And then in the Olympics in the 1980s or so, people were taking testosterone as a performance enhancer. And all heaven and earth came down on those people. And that resulted in testosterone getting scheduled as a controlled substance. But the more that we've learned about the human body, the more we've realized now that there can be a role for testosterone replacement in men when they stop producing a high level of testosterone. And it provides some of the benefits of testosterone, including muscle mass. Now, this hasn't been proven yet as an outcome of taking testosterone replacement therapy, but do you know what the number one predictor of longevity is? Muscle mass. Now, it may be a function of the fact that those people are more active, but if you look at muscle mass, and we can measure it on a CAT scan, it is the number one predictor of longevity. So we are having, I think we're live here, right, when we're chatting. We're having, I think it's December 13th, we're having a forum at the FDA on testosterone replacement therapy in men's health because it has not gotten the attention it deserves. Some men are good candidates, but there's this stigma that it's maybe wrong or maybe has, short-term benefit but long-term harm. No, the more we learn about testosterone, the more we're learning that, say, low-dose testosterone can have long-term health benefits. So I'm not here to promote a product. I'm a regulator, but this has not gotten the attention it deserves. We have a guy, Brian Christine, who's a men's health expert, and he's going to be leading this. And, we just did this big announcement on hormone replacement therapy for women. I don't know if you saw that.
I did.
We got great coverage on it, and I'm glad it did because this represents the biggest screw-up of modern medicine, the demonization of hormone replacement therapy for postmenopausal women. And, it came out of dogma. It came out of a Fauci-like figure at the NIH in the year 2002, about 23 years ago, who made this decree. And he had a study that he pointed to, even though the study was misinterpreted. And you actually looked at the details of the study that when it first came out, it did not show an increase in breast cancer that was statistically significant, yet he said it causes breast cancer. No subsequent study has found that it increases breast cancer mortality, but women were scared out of this treatment. It's a life-changing, life-saving, life-extending treatment for many women. When their body stops making estrogen between 45 and 55 years of age, they replace it with estrogen replacement plus or minus progesterone, and they feel better and live longer. It not only alleviates the short-term symptoms of menopause, that is, when I say short-term, that it can last 8 years on average. We were told in medical school, some women have symptoms of menopause, but they're usually mild and they're just last a couple years. In other words, just tough it up. These women are complaining, right? That was basically the male-dominated medical establishment. Now we know the symptoms last 8 years on average, that 80+% of women have symptoms, and for most, the symptoms are severe. Where now they're more likely to get an antidepressant when they come in for their mood swings than they are estrogen, which can alleviate these symptoms of the hot flashes, night sweats, mood swings, weight gain. I mean, marriages have been saved by hormone replacement therapy in postmenopausal women.
In what way?
Well, for example, one patient described, we just did a podcast with some experts in this field, and they said, a patient came in and said, every time I had sex with my husband, it felt like razor blades in my vagina because there's dryness associated with the menopausal changes. And so it can make sexual activity painful. And these symptoms were alleviated with hormone replacement therapy. So not only are the short-term benefits remarkable, but there are massively underappreciated long-term health benefits that are profound. And let me just mention a couple. Lowering the risk of fatal heart attacks by 25 to 50%. That's the number one cause of death in women. I mean, on a population level.
25 to 50%?
Yeah. I mean, this is top studies in the journal Circulation, one of the top cardiology journals just 2 years ago. And it prevents osteoporosis, like 90% effective in reducing osteoporosis. It reduces the risk of a bone fracture later in life. If a woman makes it to 80, there's like a 1 in 3 chance she's going to have a hip fracture. And that can be the cause of death in many women because it leads to disability and surgery and then complications. Well, the root issue is the bones were weak because the estrogen level dropped off at menopause, and it's preventable with hormone replacement therapy. It also reduces cognitive decline later in life for a woman. So the benefits are so profound that by the way, there may be no medication in the modern era, with the exception of antibiotics and a few others, that can improve the health of women on a population level more than hormone replacement therapy for postmenopausal women. If it started within 10 years of menopause, it's a key feature.
So that means 60, because the study had a number 60 in it, right?
Yeah.
So starting 10 years before 60, so you're saying starting when you're 50 years old,
So
give or take?
women experience menopause generally between the ages of 45 and 55. And so your body really should not be going without estrogen for more than several years because the estrogen keeps the blood vessel wall healthy. So it's generally believed that if you start at more than 10 years after the onset of menopause, or rule of thumb after age 60, that the benefit is not there and the risk-benefit ratio inverts. And so doctors generally don't recommend it after age 60. But most doctors haven't recommended it at all because of the dogma from the NIH 23 years ago that it increases your risk of dying of breast cancer, something that's never been found to be true in a clinical study.
And is that the
trial.
one that was released to the mainstream media first to kind of get some attention, and then that's what caused everybody to think that's those two tied to each other?
Yeah, it was very manipulative. They released it to the media without the data, and then they published the study a week later. And when we looked at it after it was published, we said, there's no statistically significant increase in breast cancer.
Who benefited from that? Who benefited from that article?
Individual careers in medicine were made. They were
Nobody financially. Like it wasn't like a big pharma company that benefited from this.
No, this was the ego of people who set out. I mean, the lead investigator of that study had said before, we have to stop the HRT bandwagon. I mean, he was on a mission.
Yeah. So, and let's stay on this. With women, young girls, when you pull up data and you say, okay, I hear people will say, speaking to a doctor, we're at a soccer match, and he says, yeah, girls are having periods earlier than ever before. Why? Well, there's many different reasons. I said, tell me the history about it. And then we pull up the history, and it says, in the late 1800s was 16, 17 years old. And in early 1900s, yeah, right there. So from 15 to 17 years old. And it went to 12 and a half to 13 years old. And then went even lower and lower. And then today it's 11 point something years old. 11 years old. And some even, especially Black and Hispanic girls, beginning puberty signs at 8 or 9 years old, with some early as 6 or 7 years old. This is the earliest in recorded history. Why is that?
I think it's because of the number of exposures of substances and chemicals in the modern world that have estrogen-like binding properties. I mean, you can go to the river and test the water, and you'll find that there are things in there with estrogen-like binding properties in the modern world, things that have never been formally studied, but we know it binds to the estrogen receptor partially, not entirely, partially. And this is a huge issue. I mean, you talk about existential threats, right, to the human race. The age of puberty has been going down by a week and a half each year for roughly the last 30 years.
Wow.
Yeah. I mean, in Europe, where they may not have some of these exposures, you still have girls going into puberty at age 14, sometimes 15. Something's going on, and we have not paid attention to this. It's in the MAHA report that this is a priority for us to look at, but something's going on. And I remember in med school, we'd learn this. They teach it in 2 seconds, just a flash line in the textbooks. And I remember that the instructor mentioned this. They were talking about puberty and the precocious puberty and other conditions. And they said the age of puberty is going down. It's now years earlier than it was a century ago. And then they moved on to the next topic in one breath. And I remember like, whoa. We're not going to pause and talk about this. And you have these issues in American medicine that live in these blind spots. And only intellectually curious people like yourself who ask about it prompts the medical establishment to look at these things. Because we have a medical system that's designed to play whack-a-mole with prescribing meds and operating on people. Prescribe, operate. And so you come in, and we've done this terrible thing to doctors in America, where you come in and you get on the hamster wheel, and you're told, here are your tools, prescribe and operate, and you can only work within the confines of your clinic, and we're going to measure you by your throughput. And so these doctors become these busy beavers, just billing, coding, writing notes, prescribing and operating, billing, coding, writing notes, prescribing and operating. And you wonder why the burnout rates are higher than any other profession, right? So we've got to stop and ask, what are we doing?